coverage you can count on continues.
Tonight from the 8 on Your Side team, Lyme disease. It's considered a significant public health issue here in Pennsylvania. The state health department says it's now spreading into more parts of the state.
As medical reporter Susan Shapiro explains, this could turn out to be a rough year based on what some healthcare professionals are seeing.
I love to hike as often as I can.
Blythe Hart loves the outdoors.
It's really, really nice to be out there when it's peaceful and quiet and just spend a little bit of time by yourself sometimes.
But the beauty of nature has left an ugly mark on the 28-year-old. Her doctor recently diagnosed her with Lyme disease. Deer can carry infected ticks that transmit the inflammatory illness to people through a bite.
She checked me out for a ton of stuff, including like my thyroid and diabetes, because I'd gained 35 pounds in 3 months, and it turns out that I had Lyme.
Pennsylvania is a leading state for Lyme disease. The state health department says last year there were 5,033 cases. There could be more this year.
We're seeing lots and lots and lots of cases of Lyme.
Longtime family physician Stephen Olin says this is the worst season that he has seen for Lyme.
We had lots and lots of rain and cool temperatures in April and May and into June, so that may play a role.
A majority of people who get bitten by an infected tick and develop Lyme get this characteristic bullseye rash. Blythe says she never had the rash. Just a slew of unexplained symptoms like numbness and shaking in her hands, headaches, knee pain, and fatigue.
I was just dismissing everything as, oh, I do this every year, or oh, I've got a bad knee, or oh, I'm just tired, I'm working too hard. And no, it turns out that there was something really wrong.
Blythe is now taking antibiotics, the usual treatment for Lyme disease. If she doesn't improve, she may have to take another round of the medication. But there is a chance she could be left with chronic Lyme.
And the earlier it's treated, the more successful it is as far as preventing any of the long-term problems with Lyme.
Blythe, who's a local actress in York and an employment recruiter, says she's missed a lot of work. And she says this has all been very stressful.
It's really tough to sort of keep making life work when your body just doesn't want to cooperate.
But she says the illness won't keep her from the great outdoors. She'll just be more vigilant about ticks. Susan Shapiro on Your Side, News 8.
The state health department says your first line of defense against Lyme disease is to avoid tick-infested areas. Hard to know where that always is, though. It also advises you to wear protective clothing. Use insect repellent that contains DEET. Do a full body check for ticks after spending time outdoors. That's a big one. And shower within 2 hours of outdoor exposure, which may help prevent transmission.